Hello everyone. Today we are going to study about the next part of guidance and counseling. In the last videos we have studied up to the types of counseling approaches. So now we are going to see the remaining part of guidance and counseling. So now we are going to see the role of the counselor. What are the roles the counselor have to play? In that, first one is arrange orientation program for the other support staffs to enlist their cooperation. So counselor alone itself, he can't do anything. He need a group of people who will help him to do the whole procedure. So for that he should give the orientation program to other staff. Next, prepare an up-to-date list of resources, information, referral and energy available to him. Next, organize the guidance committee. Next, we have set up an educational and occupational information center. Display the information collected in a attractive way. Like whatever information and educational things you are collecting, that you have to display in a attractive way. So whoever is coming to your center, they can go through it and they can gain some knowledge. Next, disseminate information through the educational and career talks, group discussion and so on. Other things you can use so the educational things can spread to others. Arrange talk by expert from different fields. Organize career days, career weeks, career conference, present day and so on. So like this, so many rules the counselor have. It is without that the counseling process or the counseling sessions will not be successful. Next we have preparation of counselor. So what are the qualities you can say, or how the counselor will prepare himself? First is educational background. The counselor should have a master or bachelor degree in teaching and education with training in behavior science. This is the educational qualification of counselor. Next is experience. At least 2 years of experience of counseling experience or 3 to 6 months of supervised counseling experience. Either it may be like he has worked as a counselor, or maybe he has observed someone giving counseling. So that experience also it will be considered here. Next, personal fitness and attributes. It should show positive interest in working with others. Like it is not like counseling is not having positive effects, then how he will motivate others? The person should have a positive interest with working with the other people. So this is the preparation you have to keep in mind when the counseling is getting prepared. Educational, experience and fitness. Next we have qualities of good counselor. In that, it's like based on your name only, good counselor. So we'll start with one by one. First, G. G stand for good technical knowledge. The counselor should have a good technical knowledge. O for obtaining appropriate information from the patient. It means whatever information is necessary, they should collect it from the patient. Next, O for objectively answering the question. Next is demonstrating the professionalism. Okay, they have to show the professionalism, like they can't be an unprofessional person. Next, C for confidentiality. Like whatever information they are collecting from the patient, they should keep it confidential. They should not reveal to others. O for observant. They should be a good observer. Then only they will come to know what is going on their mind. Like whatever they are saying, either it is true or not. If they are having any other expression, they can read the facial expression. So they should be a good observer. U for unbiased. They should not do any partiality, like this patient is very like rich, or this is poor patient, or this is racism. They should not do like any partiality. While they are treating, they should take everyone is patient. And for non-judgmental, it means without knowing the things, only by seeing the patient we should not give any comment. So that is also quality of counselor. Next, S, sensitive to the needs of the patient. It means like patient is crying, it not like if in front of you, if the patient is crying, you will laugh. So you should be sensitive towards, but based on the situation. Next is empathic. Empathic means you should show emotional effects towards the patient. L for listening carefully. So that is the main you can say techniques or components of communication. If someone is telling something to you, first you have to listen. let the person complete, then you can give reply. So when the patient is sharing their information to you, so what you have to do, they have to listen it carefully. Next is L for lets the patient make decision. So we have studied in that approaches, in that we have seen we will ask the patient to take their decision. Okay, just we will explain it. Okay, we have 5 options, this is good for you. Among these 5, which one is suit for you, or which one you are able to do, you go for it. So we'll make the patient to take the decision. Next one is O for open minded. Next is R means respect the rights of the patient. So everyone we have some rights. Okay, like if the patient is saying no, I don't want to share this information with you. Okay, what like during the treatment, because of their religious, because of their background, if they want something that they don't want to share, we can't force them. They have some rights that we have to maintain or we have to keep in our mind. So these are some good qualities that the counselor should have or must have. Next we have characteristics or qualities of counselor. The last slide I have told you about the good qualities that should, like if the counselor have that qualities, he will be the good counselor. In every person you have like normal person or the person who is very good. So same thing here, there are some other qualities and characteristics that counselor should have. In that, first we are going to see the personal characteristics, like the counselor should be embedded with the basic human qualities. Next, the counselor should be a person with cultural values and awareness. The counselor should have a deep interest in helping people. The counselor should patiently listen to the others. The counselor should be sensitive to the other's attitude and reaction, and he should have a capability to being trusted by others. The counselor should have respect for the personal autonomy of the patient. The counselor should be tolerant of and accept the patient point of view. So that first we have seen the personal characteristics. Now we are going to see the health and professional appearance. That pleasing voice and appearance should be there. Vitality and endurance should be there, free from any mannerism. Next is leadership skill, the ability to stimulate, reinforcement, important information, direct the counsel to way to solve the problem. Next is philosophy of life, good character, integrated personality, faith in human values. Next we had professional dedication. In that, show some enthusiasm, like he is very interested or he is having like energy to do that. Maintain helping relationship and have a nice sense of morality. So these all are the characteristics, like some personal, some professional, some like philosophical, or some leadership skill, and some health personal and personal appearance. These are some qualities and characteristics the counselor should have. Next we have counseling process, or you can say steps, or you can say phases. Okay, same thing, counseling process or counseling steps or counseling phases. In that we have 5 phases: phase 1, phase 2, phase 3, phase 4, phase 5. The first one is establishing relationship. It means like whenever the patient is coming or counsel is coming to the center, first you have to make a relationship, like saying hi, hello, how are you, so that that relationship will build. Next you have to go for assessment, like you have to ask the information regarding the problem, you have to collect all the data, it may be subjective or objective. Next is setting goal. So now you know the problem, you know the what is the problem or what is the things that is troubling to the patient. So based on that you have to set a goal. Okay, my aim is you have to give this to the patient, or patient should recover from this problem, or he should get a solution for this problem. After that you have to do the intervention. Intervention means like now you know the problem, you set your goal, so based on that you have to work on it, that is intervention phase. The last one is termination and follow up. So now the session is over. So at the end of the session you are going to tell the patient like you follow these other things for 1 month or 1 week. After that you come for follow up, we'll see how much it is improving on you, how much it is affecting on your problem, or you are getting any improvement or not. So these are the some process of guidance and counseling. So with this we have finished the counseling process, and remaining part we'll see in the next video. Thank you everyone.